I call the member for Bradfield.
Thank you, Madam Deputy Speaker. I'm very pleased to rise to speak on the Fairer Private Health Insurance Incentives Bill and related bills. Madam Deputy Speaker, the House has before it this afternoon a debate about a very simple, clear-cut issue. Should the Australian tax system encourage all Australians, or as many who are as able to do so, to provide for their own medical expenses through taking out private health insurance? Or should it instead, as this government proposes, put private health insurance and choice of medical provider even further out of the reach of many Australians? Because regrettably, Madam Deputy Speaker, that will be the effect of the fundamentally misconceived provisions in the bill which this House is debating this afternoon. Madam Deputy Speaker, when it comes to the question of private health insurance, Labor has form. Labor is relentlessly hostile to private health insurance. Labor is hostile to private hospitals. Labor is hostile to the notions of Australians seeking to be reliant on their own resources, seeking to make provision for themselves and their families rather than relying solely and exclusively on the public system. And, Madam Deputy Speaker, it is a shame to say that this bill is redolent with the ideological hostility towards private health insurance and towards self-provision, which is at the absolute core of Labor's approach to this issue. And that is why, Madam Deputy Speaker, this bill is designed to make it harder for Australians to help themselves and their families. This bill is designed to make it more expensive to take out private health insurance. This bill is designed to penalise many of those who are seeking to provide for themselves rather than being a burden on the public purse. Madam Deputy Speaker, let us remind ourselves what the principal provisions in the bill before the House this afternoon are. Firstly, the current private health insurance rebate, which is for most people set at 30% of expenditures and for older people somewhat higher than that, will be reduced for those who are above certain income levels. And if you are a single and your income level is more than $124,000, the rebate will be reduced to zero. If you fall at certain income levels below that, the rebate will be reduced by lesser amounts. The second major provision in this bill is to increase the current Medicare levy surcharge on your tax bill, which applies if you do not have private health insurance. Today that stands at 1 percentage point. In the new world, should this bill pass the House, that rate will increase to 1.25% for a single with an income above $93,000 and 1.5% for a single with an income above $124,000. Now, Madam Deputy Speaker, we have had some highly illogical and internally inconsistent arguments in support of this measure. Just today, the Prime Minister drew a comparison in the House between a highly paid businessman earning $500,000 a year and an apprentice earning much less, and argued that in the absence of the measures contained in this bill, there is an unsavoury degree of cross-subsidy on the part of the apprentice to the businessman who has the benefit of the private health insurance rebate. A brief look at the numbers, Madam Deputy Speaker, indicates what a ludicrous claim that is. The tax on $500,000, so the businessman in the case given by the Prime Minister, the tax on $500,000 is $206,050 prior to the application of the rebate, and if we assume a typical level of private health insurance premium, then that tax bill will be reduced by a mere $720. By contrast, if we take somebody earning $50,000, their tax bill is $10,200. So the suggestion that in some way the person paying $206,050 a year in tax is freeloading on the person paying $10,200 in tax, which was essentially the argument put by the Prime Minister of the House, is self-evidently not worth considering when you take even the briefest look at the actual numbers. I want to make 3 points in the brief time available to me, Madam Deputy Speaker. Firstly, that the measures inherent in this bill to fundamentally attack the provision of the private health insurance rebate are an appalling abandonment of what was apparently previously an ironclad commitment. Secondly, that we have seen from the Labor side of politics for many years a consistent mismanagement of policy in the area of private health insurance, founded on their implacable ideological hostility to the private health insurance industry. And thirdly, that the ill-designed and ill-thought-through measures in this bill will seriously damage choice and equity in healthcare in Australia. Let me turn to the first point, Madam Deputy Speaker, and remind the House, as a number of other speakers have done, of commitments that were made in the lead-up to the 2007 election by a number of eminent members of the Labor Party. The member for Gellibrand had this to say: on many occasions for many months, Federal Labor has made it crystal clear that we are committed to retaining all of the existing private health insurance rebates, including the 30% general rebate and the 35% and 40% rebates for older Australians. Then committed, now apparently commitment out the window, completely meaningless. What did then opposition leader Kevin Rudd have to say just before the 2007 election? In a written commitment, in a letter to the industry body, he had this to say, quotes, "Both my Shadow Minister for Health, Nicola Roxon, and I have made clear on many occasions this year that Federal Labor is committed to retaining the existing private health insurance rebates, including the 30% rebate and the 35% and 40% rebates for older Australians," close quotes. Madam Deputy Speaker, this is a shameful abandonment of a commitment previously given by the Labor Party. The second point I wish to make is that the policy area of private health insurance is one which has been subject to consistent mismanagement by Labor during its times in government over many years, and by contrast, the Coalition has shown a sure hand in seeking to maximise the number of people who take out private health insurance and thereby contribute themselves towards the cost burden of a health system which would otherwise fall entirely on the public purse. When Medicare was introduced in 1984, there was a decline which began in the percentage of the population covered by private health insurance. And by 1998, only 30.4% of the population was covered by private health insurance. I need hardly add the obvious point that this left the vast majority of Australians drawing on the publicly funded system, putting it under substantial pressure. The Howard government, I'm pleased to say, unlike the approach of the present government, tackled this pressing policy problem with measures that were well designed and which achieved their desired outcome. The desired outcome, of course, was to increase the proportion of Australians with private health insurance cover, that is to say, to increase the proportion of people who are taking upon themselves the burden of funding their own health needs rather than simply leaving it to the public purse. The measures introduced by the Howard government involved a mixture of carrot and stick. The carrot, of course, was the introduction of the tax rebate, which is now under such savage attack in the legislation before the House today. And the stick, of course, was that if you did not take out private health insurance above certain income thresholds, you were then required to pay the 1% Medicare levy surcharge. And those measures were extremely successful. By 2007, private health insurance coverage had climbed to 44.6% of the population. Let me add that in my own electorate of Bradfield, 85% of households have private health insurance. In other words, a very substantial proportion of the people in my electorate of Bradfield have taken the decision to incur out of their household budget expenditure against their future health needs, because they want to make sure that they are doing what they can to provide for their own health needs and the costs of those health needs, rather than simply leaving it to the public purse to support their health needs, and I commend them for doing that. Let me turn, therefore, Madam Deputy Speaker, to the third point, and perhaps the one which is most important as the House considers this package of measures before us this afternoon. What will their impact be on the policy objective of choice and of equity in the Australian healthcare system? I'm sorry to say, Madam Deputy Speaker, the effect of these measures will be very damaging. Some 2.4 million Australians are directly affected, and they face immediate increase in premiums, depending upon which tier they fall within, of between 14% and 43%. In turn, it is likely that there will be a material reduction in the percentage of Australians who hold private health insurance. Conversely, there may also be people reducing the tier of insurance they hold. Private health insurance premiums are likely to rise, and the inevitable consequence will be more pressure on the public health system and more pressure on the public purse, which funds that public health system. Analysis by Deloitte, which has been cited by a number of speakers in the House this afternoon, Madam Deputy Speaker, predicts that some 1.6 million consumers are likely to withdraw from private health insurance cover, a number which is very, very different from the Panglossian assumption in the work done by the Treasury that a mere 25,000 people will give up coverage. The further issue which presents itself, Madam Deputy Speaker, is that the dollars which are purportedly saved out of this exercise must be offset against the extra cost which the government and in turn taxpayers will be required to bear towards the cost of the public health system. According to research conducted by Econtech and other parties in 2004, for every dollar of public funding going into the private health insurance rebate, $2 was saved. That's to say, $2 towards the cost of the health system that was met by private health insurers, rather than being required to be paid out of the public purse. Madam Deputy Speaker, many of the arguments that have been made by government in favour of this measure do not bear up to close scrutiny. It is claimed to be a savings measure, but in fact, in real terms, it is in fact a tax increase, because Australians above a certain income tax threshold who do not take out private health insurance will now face a further increase in their income tax rate, which could be as high as going from 1 up to 1.5%. This, in turn, creates what might be described as a price shield for private health insurance premiums, as the eminent economist Henry Ergas has argued in the Australian newspaper today. And the corollary of that, the consequence of that, is that there will be an upward force on private health insurance premiums which would not have existed in the absence of the measures contained in this bill. The consequence, in turn, is that private health insurance will be becoming increasingly unaffordable for a proportion of Australians. When you step back and look at the overall impacts of these measures, Madam Deputy Speaker, it's very difficult to avoid the conclusion that what the Labor Party is doing here is pushing us towards a two-tier health system in Australia, where the poor or the less well-off are in the public system and the more affluent are being pushed into a private health insurance-funded private system. That seems a very curious approach for a Labor Party to be taking. It is a profound attack on the principles of both economies of scale and equity that the public health system is supposed to deliver, and it is one of the many curiosities of this deeply ill-conceived piece of legislation which attacks fundamentally Australians who seek to provide for themselves.